Hi, my name is Rachel Spaeth. I'm from Freedom Physical Therapy, and today I wanted to talk a little bit about osteoarthritis with you. More so, what is osteoarthritis? What are some of the common symptoms you might see if you have osteoarthritis? And then what type of exercise is best? So first of all, what is osteoarthritis? So between the joints, you have what's known as cartilage. And all osteoarthritis is a breaking down of that cartilage between the joints. Things that can lead to osteoarthritis, there's many factors, but some are age, genetics can play a big part, overuse or improper use, injury, previous injury, or just weakness and instability in different parts of your body can lead to altered mechanics when you exercise or walk, which can cause a quickening, a quicker wearing down of the cartilage. So if you have osteoarthritis, what are some of the common symptoms that you might see? Just a few that I wanted to mention. Pain, of course, is a common symptom, the most common. Stiffness, limited range of motion in that joint. Potentially some clicking within the joint, like especially your knee if you're bending. You might also hear some cracking in the joint. Those are some of the most common. So if you have osteoarthritis, which is incredibly common in today's society, what do you do? Well, exercise programs that combine both strengthening, flexibility, stability, and aerobic exercises are known to be kind of the best option for treating these conditions. So what does that mean? So first of all, low impact is very important. If you already have a breaking down of the cartilage between the joints and your hip, knees, ankle, whatever joint it is, doing high impact exercises, a lot of running, jumping, those types of things can cause that wearing down to happen quicker and can actually make the condition worse, whereas low impact exercises can work on strengthening the joints and the muscles and everything around that joint that's irritated while not causing more inflammation, more breakdown of that cartilage, and it'll just reduce the stress around the joint in general. So I just wanted to briefly go over some stretches and strength things that I thought would be good. Now, a preface to this, not everyone is the same, obviously, so not all of these will work for everyone. But just as an overview, these are some things that I thought for people with lower extremity osteoarthritis may be good options, but obviously don't do them if you are performing the exercises and they cause increased pain. So for stretches, just a couple things if you're experiencing hip, knee, or ankle osteoarthritis are calf stretches are always good. Hamstring stretches, more so like seated hamstring stretches are great. And then hip stretches, you can do hip flexor stretches in standing or lying. And then glute stretches, so just a nice simple knee to chest stretch or a piriformis stretch where you pull across your body. All those are good options to just maintain flexibility within your joints. Also a quad stretch, if you can, the front of your leg, if you can do that in standing, if that's not painful. Otherwise, there are ways to do it in lying. That's just a general overview just to maintain flexibility. Again, if you have questions on exactly how to perform the exercises, ask a physical therapist and we can let you know. I just kind of want to give an overview. Strengthening exercises, first of all, like lying straight leg raises, leg lifts can be good for the front of the hip, front of the leg. Squats can be a good exercise. However, if you have hip or knee issues and you're doing squats and it causes any increased pain, probably not for you. But as I'll get to in a minute, you can do similar exercises in the water that can be just as beneficial, if not more beneficial, for people with OA. Other exercises that you may have heard of for the hip, you can do monster walks, which you can use a TheraBand that you put around your ankles and step side to side to just kind of work on strength throughout the sides and backs of your hips. Bridges, lying on your back where you bend your knees and lift your butt into the air and hold. Those can also be great for stability, strength, and then water-based exercises. So why water is such a good option for people with OA is it's so low impact, and you can still do all the same exercises basically that you're doing on land, but if doing them on land is too painful, too much stress, too much wear on the joints, water is definitely a great option. So just walking in water is a great option. A lot of times people with knee or hip OA, if they try to walk on a treadmill, you know, they get 5, 10, 15 minutes in and they just start having a lot of pain because it's too much impact, too much wear and tear. As you get stronger, hopefully you'll be able to do more exercise on land, but water is a good exercise for people who are really flared up or have a lot of degeneration. So walking, you can do squats, lunges, basically anything you can do on land you can do in the water. It just offloads the joints a little bit more. So that was basically just an overview of what OA is, and if you're someone who's struggling with it and you're looking for exercises, stretches, stability exercises, balance exercises to do, you know, feel free to come in and have an assessment by a physical therapist, and we can kind of give you options that are best suited to you, because like I said, this is just a very brief overview and not everyone's the same, so it's really nice to have a program that's customized for you. But overall for OA, activity is good, but in moderation, low impact, and you're just trying to increase strength and stability throughout and around that joint that's affected. So thank you very much for listening. Again, I'm Rachel from Freedom Physical Therapy. Have a nice day.